So at the Community College Baltimore County, we have both the cognitive or knowledge and the psychomotor or skills pieces to EMS education. We have a very heavy cognitive piece that in the classroom, but we're also very well equipped in terms of being able to get the knowledge from, from cognitive to psychomotor skills, as you know, being able to do things like starting an IV, managing an airway, doing CPR, those kind of things are very important to both an EMT and a paramedic. We are in our ambulance simulator here at the Community College Baltimore County Emergency Medical Technology Program. Can you tell us a little bit about how this impacts student education from the student's point of view?
So now, as you said, there is a huge cognitive and psychomotor section of the portion of the class. CCBC strives to keep things very authentic and real life as possible. I know from personal experience coming through and using this very simulator, it was extremely helpful in transitioning from a classroom setting into real life. It's set up very similar to a real life ambulance as far as you get to feel the close proximity that you will be working with patients. It's set up as far as you have your airway stuff at the head of the patient, where on most ambulances that stuff will be. So you kind of learn the muscle memory. You have just your oxygen, wall-mounted suctioning. Your life pack is usually at the head of the patient or at the back of the stretcher. The sim mannequins themselves are awesome. You can start IVs on these. You can do EKGs. You can do chest compressions. You can intubate them. You can put nasal pharyngeal airways and OPAs. Down in this section, we have IV supplies, drugs. They try to just keep it as authentic as possible and as close to real life as possible, and I felt that was just extremely, extremely helpful going from here out to the streets. Even the stretcher is functioning. You get good practice pulling it in and out with the patient's weight on it. And it's in a safe environment where you're not going to get harmed as if you were in real life trying it for the first time. And you're also not going to do any harm to a patient because it's not a real patient.